Every day, millions of people reach for medications to ease pain, lower blood pressure, reduce acid reflux, or fight infections. And while these drugs can be helpful, even life-saving, they can also come with a hidden cost: your kidney health. Your kidneys filter blood, remove toxins, balance fluids, and keep your entire body in check. But some medications, when used too often, in high doses or combined with others, can overwhelm or even damage them. In today's video, we're revealing 8 medications that may be harming your kidneys, and chances are, at least one of them is in your medicine cabinet right now. Stick around because what you learn today could protect your kidney function for years to come. Let's dive in. Number 1. Nonsteroidal anti-inflammatory drugs or NSAIDs. This includes household names like ibuprofen, Advil, Motrin, naproxen, Aleve, and even aspirin in higher doses. NSAIDs are among the most commonly used medications in the world. In fact, around 30 million people worldwide take NSAIDs every single day, many of which are available over the counter. They're great for relieving pain, inflammation, and fever. But there's a downside, especially if you use them frequently or in high doses. NSAIDs work by blocking enzymes called COX-1 and COX-2, which help produce prostaglandins, hormone-like substances that promote inflammation. But prostaglandins also help maintain healthy blood flow to your kidneys. When you suppress prostaglandins too much, blood flow to the kidneys can drop, especially in people who are already vulnerable, like the elderly, those with high blood pressure, diabetes, or dehydration. Over time, this reduced blood flow can lead to acute kidney injury or worsen chronic kidney disease. A 2006 study in the Journal of the American Society of Nephrology reviewed data from over 10,000 individuals who were prescribed NSAIDs for different health issues. It found that using NSAIDs increased the risk of acute kidney injury by 26%, particularly during the first month of use. This highlights the importance of being cautious when using or prescribing these drugs. NSAIDs aren't evil, but they're not as harmless as we think. If you need them, use the lowest effective dose for the shortest time possible. And if you have kidney disease or you're taking other medications that affect kidney function, talk to your doctor about safer alternatives. Number 2. Antibiotics. While antibiotics are essential for fighting bacterial infections, some of them come with a hidden danger: potential kidney damage. This is especially true for powerful antibiotics like gentamicin, vancomycin, and ciprofloxacin. These medications can be nephrotoxic, meaning they have the potential to harm the kidneys, particularly when used in high doses, over long periods, or in people with pre-existing kidney issues. Aminoglycosides like gentamicin are known to be especially harmful to the kidneys. They can damage the tiny filtering structures inside the kidneys, known as renal tubules, leading to a condition called acute tubular necrosis, a common cause of acute kidney injury. Vancomycin, often used for serious infections like MRSA, also poses a risk, particularly when combined with other nephrotoxic drugs. Even fluoroquinolones like ciprofloxacin, which are often prescribed in outpatient settings, have been linked to rare cases of kidney inflammation and dysfunction. While antibiotics save lives, it's important to use them carefully and only when truly needed, especially if you're at risk of kidney issues. When prescribed, take the exact dose for the full duration, even if you start feeling better. This not only protects your kidneys but also helps prevent antibiotic resistance. Coming in at number 3 are diuretics or water pills. This might have surprised you because these drugs are typically considered good for the kidneys. Diuretics are used to treat fluid retention or swelling, which often occurs with heart failure, kidney issues, or liver cirrhosis. While some are available without a prescription, the stronger ones typically require one. Common diuretics include hydrochlorothiazide, HCTZ, bumetanide, Bumex, furosemide, Lasix, spironolactone, aldactone, and acetazolamide, Diamox. They work by increasing urine output, helping the body eliminate excess salt and water. This also makes them useful for managing high blood pressure, a major risk factor for kidney disease. So in many cases, diuretics can actually benefit kidney health. While diuretics are generally helpful, they do carry some risks, especially for your kidneys. Unlike NSAIDs, they don't directly impair the kidney's filtering ability. Instead, they affect a later stage in kidney function by changing how urine is concentrated and altering electrolyte levels. This can lead to increased urination and, in high doses or with prolonged use, may cause dehydration, a known risk factor for kidney damage. A study published in BMJ found that new users of diuretics had a significantly higher risk of being hospitalized for acute kidney injury, especially when the medication was used alongside other drugs like NSAIDs or ACE inhibitors. That's why it's crucial to talk to your doctor before combining diuretics with other drugs. For people with CKD, staying hydrated and monitoring kidney function and electrolyte levels is essential. And with today's home testing kits, it's easier than ever to do that from home. Number 4, proton pump inhibitors or PPIs for short. This includes omeprazole, Prilosec, esomeprazole, Nexium, pantoprazole, Protonix, and lansoprazole, Prevacid. These drugs are designed to reduce stomach acid and are commonly used to treat acid reflux, GERD, stomach ulcers, and heartburn. They work by blocking the enzyme in the wall of the stomach that produces acid, reducing acid levels for long periods of time. But here's the problem. Millions of people take PPIs much longer than intended, sometimes for months or years, when they're meant for short-term use, and this overuse can seriously harm your kidneys. A 2016 study published in JAMA Internal Medicine found that people who used PPIs had a 20 to 50% higher risk of developing chronic kidney disease compared to those who didn't take them. PPIs can cause acute interstitial nephritis, a form of kidney inflammation that can develop without warning. They can also lower magnesium levels in the body, and that imbalance may further harm kidney cells and impair how well the kidneys filter waste. In summary, PPIs can be very helpful when used properly, but when overused, they may silently damage your kidneys. Use them for the shortest time needed. Ask your doctor about alternatives, and always monitor your kidney health if you're on these medications long term. Number 5, ACE inhibitors and ARBs. Now this one might seem confusing because ACE inhibitors and ARBs are actually prescribed to protect the kidneys, especially in people with high blood pressure or diabetes. So why are they on this list? ACE inhibitors like lisinopril and ARBs like losartan and valsartan are widely used to treat high blood pressure, heart failure, and diabetic kidney disease. And yes, they can protect your kidneys over time by lowering pressure in the tiny blood vessels that filter waste. But here's the thing. In certain situations, especially in older adults, these drugs can actually do more harm than good, if not properly monitored. ACE inhibitors and ARBs work by relaxing blood vessels and lowering blood pressure. But if your blood pressure drops too low, or if you're also taking diuretics or NSAIDs, the kidneys might not get enough blood to function properly. That can lead to a sudden drop in kidney function or acute kidney injury. One large study found that combining ACE inhibitors or ARBs with NSAIDs and diuretics increases the risk of acute kidney injury by over 3 times, a dangerous combo known as the triple whammy. If you're on one of these medications, stay hydrated, avoid mixing them with NSAIDs unless your doctor approves, and never skip your lab work. Used properly, ACE inhibitors and ARBs can protect your kidneys, but when combined with the wrong factors, they can do more harm than good. Number 6, antiviral medications. While antiviral drugs play a vital role in fighting infections like herpes, shingles, HIV, and hepatitis B, some of them can quietly stress your kidneys, especially if taken long-term or without proper monitoring. Medications such as acyclovir and tenofovir are widely prescribed and generally effective, but they're not without risks. Acyclovir, particularly when given in high doses or through an IV, can crystallize in the kidneys and block the tubules responsible for filtering waste. This blockage can lead to a sudden decline in kidney function known as acute kidney injury. Tenofovir, often used in HIV treatment, has been linked to chronic kidney damage over time, particularly affecting the kidney's ability to reabsorb vital nutrients and minerals. Fortunately, the risk can often be reduced with simple steps. Drink plenty of fluids, follow the prescribed dose closely, and have your kidney function checked regularly through blood tests. In many cases, your doctor may opt for newer formulations of antivirals that are gentler on the kidneys. Number 7, lithium. Lithium is a well-known and highly effective medication used to treat bipolar disorder, helping to stabilize mood swings and prevent both manic and depressive episodes. However, while it has helped countless individuals manage their mental health, lithium can be toxic to the kidneys over time, especially when not carefully monitored. Long-term lithium use has been linked to a condition known as chronic tubulointerstitial nephritis, which is a type of kidney inflammation that can gradually impair kidney function. In some cases, this damage can progress to chronic kidney disease, or CKD, if not addressed early. The risk increases the longer a person stays on lithium and the higher the concentration of lithium in the blood. To make matters more complex, as kidney function declines, the body has a harder time clearing lithium, which can lead to a buildup of the drug and potential lithium toxicity, a dangerous situation that can affect not only the kidneys, but also the nervous system. To reduce the risk, patients taking lithium should have regular blood tests to monitor lithium levels and kidney function, typically every 3 to 6 months. It's also important to stay well hydrated, as dehydration can cause lithium levels to rise rapidly. In some cases, if kidney function begins to decline, doctors may adjust the dose, recommend switching to another mood stabilizer, or refer the patient to a nephrologist for co-management. Number 8, chemotherapy drugs. Some powerful chemotherapy drugs like cisplatin, methotrexate, and ifosfamide can be tough on the kidneys. While they're highly effective at killing cancer cells, they can also damage the kidney's filtering units, leading to acute kidney injury or longer-term problems. Cisplatin, for example, is well known for causing kidney toxicity, while high doses of methotrexate can lead to crystal buildup that blocks kidney function. Ifosfamide may impair the kidney's ability to absorb vital nutrients, a condition known as Fanconi syndrome. People undergoing chemotherapy are especially vulnerable due to factors like dehydration, low immunity, or concurrent use of other kidney-stressing drugs. Fortunately, doctors can often reduce the risk with hydration protocols, dose adjustments, and regular kidney function monitoring. And there you have it. 8 common medications that could be silently harming your kidneys, especially if taken too often, in high doses, or without proper medical supervision. If you're on any of the drugs we mentioned, don't panic. Just make sure you're working closely with your doctor, getting regular blood tests, and staying informed. If you found this video helpful, give it a thumbs up, subscribe, and tap that notification bell so you never miss out on more health tips like this. Thanks for watching, stay healthy, and I'll see you in the next video.